4,000 eggs and embryos, potential lives gone. The damage at the University Hospital's fertility clinic is nearly double the number that was first reported. Good evening, I'm Chris Tyen for Russ.
And I'm Sarah Shookman. The reason for the malfunction? Human error. Someone shut off a remote alarm system on that tank.
Channel 3's Monica Robbins first broke this story. She's live for us tonight. Monica, investigators found more issues with this tank now.
Yeah, Chris, they actually did, but we have some answers, but not all. And tragically, this catastrophic failure is more than on just one level. In a letter sent to fertility patients impacted by the cryotank failure, University Hospitals outlined several reasons why the system failed. The most concerning cause was human error.
Remote alarm that we thought was working was deactivated. We don't know when it was deactivated or who was responsible for deactivating it.
The tank appeared to be filled with liquid nitrogen and at the correct temperature when the staff left on Saturday. When they returned Sunday morning, they heard the alarm. The alarm that was shut off is the one that should have sent an alert message to the designated embryologist that there was a problem.
A computer triggered deactivation as far as we can tell, so it wouldn't be on site in terms of the deactivation as far as I can tell.
UH is still investigating how and who shut it off, but since the failure, they've changed protocol.
The lesson to be learned is redundancy, which we have built in now. We have 3 levels of redundancy for these alarms. We have multiple alarms on all our critical, not just the freezers, but incubators, refrigerators, freezers, etc.
The new alarms will send text messages and emails to 3 staff members who will also wear beepers. Little consequence for the nearly 1,000 patients who lost a combined 4,000 eggs and embryos. But UH is taking full responsibility and vowing to help those impacted.
We very much want them to know that we will take care of them, provide additional cycles at our cost. There is no obligation to sign a legal release to take advantage of this.
So while the hospital admits human error, there was another issue they were dealing with. The automatic fill on that long-term cryo tank wasn't working. They contacted the manufacturer trying to fix it, but unfortunately this crisis happened before they could get that done. Meanwhile, an NBC News investigation reveals more about the Michigan company that manufactures these tanks. Here's NBC's Kate Snow with that story.
An NBC News investigation has found the manufacturer of the tank used at the center, Custom Biogenics Systems, has a history of previous malfunctions dating back almost 15 years.
They simply said that there had been a technical malfunction with the unit that was storing the sperm of my husband.
Rachel Southwood's husband Andrew had sperm frozen in 2003 in the UK after he was diagnosed with cancer, but a freezer malfunctioned. Her husband passed away and his sperm was no longer viable. Several months later, British regulators warned that freezers made by CBS had problems with their automatic filling mechanism. The manufacturer is aware of 21 incidents in the UK, regulators said. The British warning was withdrawn when the supplier told regulators the devices were being upgraded. But 2 years after the warning was first issued, a similar incident in Gainesville, Florida. Male patients, many with cancer, lost frozen sperm when a tank made by the same manufacturer failed.
There's a regulatory vacuum in the United States.
Dub Fox is the director of the Center for Health Law Policy and Bioethics at the University of San Diego.
It's not just fertility clinics, it's sperm banks, egg vendors, surrogacy agency, in all these areas. Well, we don't know how common the mistakes are.
There are numerous regulators and organizations that all have a piece of the oversight puzzle, but when NBC News' investigative unit asked who's ultimately responsible, most said it wasn't them. The only government agency that told us it technically could regulate storage tanks is the FDA. But because freezers in fertility clinics have not been specifically marketed as medical devices, they don't.
So NBC repeatedly reached out to CBS for comment, but they have declined. The hospital investigation will continue and there will be accountability. But the other question is, can this fertility center survive this entire episode? Dr. Liu says it can, based on its long success rate. Reporting live in Beechwood, Monica Robbins, Channel 3 News.
Monica, you have shown us in the last few weeks here there is little to no oversight into these fertility clinics, and they've largely been self-regulated. Will that change now?
You know, Dr. Liu didn't want to comment on that aspect until the investigation is over. But what I can tell you, as you heard in Kate's piece, no, there's very little oversight. And already calls have been made for state and federal legislation. Remember, this wasn't just university hospitals. A similar situation happened in San Francisco the very same weekend. And this story has gone global. So you can bet there's going to be somebody looking into this. Back to you, Sarah.
Absolutely. Monica Robbins outside of Ahuja Medical Center tonight. Thank you.